Hello and welcome. Today we're diving into a condition that can significantly impact one's quality of life, anismus, also known as paradoxical puberectalis contraction or dysenergic defecation. This often misunderstood condition affects the coordination of muscles crucial for bowel movements. We'll explore what it is, why it happens, how it's diagnosed, and what can be done to manage it effectively. Let's begin. So, what causes this frustrating condition? The precise cause of anismus is often multifactorial and not always easy to pinpoint. However, it typically arises from a learned or developed dysfunction in the pelvic floor muscles. Factors that contribute to this include chronic straining during bowel movements, psychological stress, a history of anal fissures or hemorrhoids causing pain and subsequent avoidance, or even learned habits of improper toilet posture and technique. Neurological conditions, although less common, can also disrupt the nerve signals controlling the pelvic floor muscles and contribute to anismus. Now, let's understand the pathophysiology. Normally, during defecation, the puberectalis muscle, which loops around the rectum, relaxes, straightening the anorectal angle. The external anal sphincter also relaxes. In anismus, however, this coordination fails. The puberectalis andon or the external anal sphincter paradoxically contract or fail to relax adequately during attempted defecation. This creates an obstruction, making it difficult or impossible to evacuate the bowels effectively, even when the rectum is full. Imagine trying to open a door while someone is simultaneously holding it shut. That's essentially what's happening in anismus. While precise numbers are difficult to obtain, anismus is considered relatively common, especially in individuals with chronic constipation or fecal incontinence. It affects both men and women and can occur at any age, although it is often diagnosed in adulthood. It's estimated that dysenergic defecation contributes significantly to chronic constipation, with some studies suggesting it may be a factor in up to 50% of patients experiencing chronic constipation symptoms. Because of overlapping symptoms with other conditions like irritable bowel syndrome, it may be underdiagnosed. The signs and symptoms of anismus can be quite distressing. Patients often experience chronic constipation, characterized by infrequent bowel movements, hard stools, and excessive straining. There's frequently a feeling of incomplete evacuation, as if the bowels are never fully emptied. Many individuals report needing to manually disimpact stool from the rectum. Pain or discomfort in the rectum or anus is common, as is bloating and abdominal distension due to stool buildup. The constant straining can also lead to the development of hemorrhoids and anal fissures, further exacerbating the discomfort. Diagnosing anismus typically involves a combination of medical history, physical examination, and specialized tests. A doctor will ask about your bowel habits, symptoms, and any contributing factors. A digital rectal exam is often performed to assess the pelvic floor muscle tone and coordination. An erectal manometry is a key diagnostic tool, measuring the pressures in the rectum and anal canal during simulated defecation. This test can identify the paradoxical contraction or inadequate relaxation characteristic of anismus. Another helpful test is a balloon expulsion test, where a small balloon filled with water is inserted into the rectum, and the patient is asked to expel it. Difficulty or inability to expel the balloon suggests impaired defecation mechanics. While anismus itself isn't typically classified into distinct types, it's important to recognize that the underlying mechanisms can vary. Some individuals may primarily experience a failure of the puberectalis muscle to relax, while others might have excessive contraction of the external anal sphincter. Yet others could have a combination of both. It's also worth noting that anismus can occur alongside other pelvic floor disorders, such as pelvic floor muscle weakness or hypertonicity. It's a complex problem, and addressing all contributing factors is essential for effective management. Treatment for anismus focuses on retraining the pelvic floor muscles and improving bowel habits. Biofeedback therapy is a cornerstone of treatment. During biofeedback, sensors are used to monitor the activity of the pelvic floor muscles, and the patient receives real-time feedback on their muscle contractions and relaxations. This allows them to learn how to coordinate these muscles correctly. Other helpful strategies include proper toilet posture, such as using a squatty potty to elevate the knees, dietary modifications to increase fiber intake, and the use of stool softeners to make bowel movements easier. In rare cases, surgery or botulinum toxin injections into the pelvic floor muscles may be considered, but these are generally reserved for individuals who haven't responded to conservative treatments. While completely preventing anismus may not always be possible, there are several steps you can take to reduce your risk. Avoid chronic straining during bowel movements. Maintain a healthy diet rich in fiber to prevent constipation. Practice good toilet habits, including taking your time and using proper posture. Manage stress effectively, as stress can contribute to pelvic floor muscle dysfunction. Seek prompt medical attention for any anal pain or discomfort. And, most importantly, be mindful of your pelvic floor muscles and learn to relax them consciously. The prognosis for anismus is generally good with appropriate treatment. Biofeedback therapy is often highly effective in retraining the pelvic floor muscles and improving bowel function. However, it's important to be patient and consistent with treatment, as it can take time to learn new muscle patterns. Recent research has focused on refining biofeedback techniques and exploring new therapeutic approaches, such as neuromodulation, to improve outcomes. Furthermore, research is ongoing to better understand the underlying causes of anismus and to develop more targeted treatments. By combining lifestyle modifications, behavioral therapies, and ongoing research, we can help individuals overcome this challenging condition and improve their quality of life.